What's up, guys? How's it going? Cade More Muscle. Right now, I'm a nursing student, but soon I'll be in the medical school. And so I just wanted to share with you guys something that I think is really important. And this is a preventative disease. So if you listen to this and if you do what I say, you can avoid this disease, right? And this is a preventative way to avoid diseases. So I'd much rather you do this instead of getting the disease later on, right? So today we're going to be talking about atherosclerosis. And basically, atherosclerosis, sorry, it's hard to pronounce, but this is basically a disease where you have plaque in your arteries. And over time, this can do a lot of damages, right? This can cause high blood pressure, high cholesterol, high triglycerides, um, diabetes, insulin resistance, obesity, inflammation that can lead to lupus, arthritis. That's basically where your body attacks itself. It has an autoimmune disease and it attacks itself, right? Um, so basically, the risk factors of this is a family history, right, of heart disease. But I think that's a pretty low one. Unhealthy diet, that's a big one. Diabetes. So basically, once you get diabetes, you can get heart disease way easier, and your risk for going to the hospital goes up like times by five. So once you have diabetes, you're going to be a lot less healthy, and especially if you have type 2 diabetes where you can reverse it. You can get rid of diabetes, right? So once you get diabetes, your risk factors for getting sick go way up. High blood pressure, high cholesterol, um, inflammation, lack of exercise, obesity, sleep apnea, smoking, and tobacco use, right? So these are all things that can cause atherosclerosis. Sorry, it's hard to pronounce, but um, now let's talk about it. So what happens is over the years of doing unhealthy, like not exercising, not taking care of your health, being overweight, what does it do to you? Well, it starts coronary artery disease. This is when you have chest pain and heart attack and heart failure, right? Then you'll have a carotid artery disease, peripheral artery disease, aneurysms. That's when basically like a vein bursts and the bleeding like will be um, basically in your body, and you'll die instantly. Not instantly. There's very low survival rate on that. But your risk for aneurysms increase when you have that plaque in your blood, right? Um, so aneurysms, like say for example, if you have an aneurysm in your neck, you're basically dead. Like there's no way you're surviving because you'll be dead within 5 minutes because your lungs will fill up with blood and you're not gonna be able to absorb oxygen. And about with 5 minutes of no oxygen, your brain is already dying. So aneurysms are very scary and not something you want. This also can cause chronic kidney disease. And guys, remember, chronic kidney disease, that's basically when we tell patients, hey, you have 6 months to live. If you have stage 4 chronic kidney disease, like you have 6 months to live because your body can't clean itself, right? So you have toxins going around your body, and this is very harmful for you. So this all comes from atherosclerosis, right? What is that? It's really easy to prevent atherosclerosis. What do you gotta do? Well, don't smoke, eat healthy foods, exercise regularly, maintain a healthy weight, and obviously doing hospital checks and maintaining a healthy cholesterol and blood sugar levels, right? So if you can do that, your risk for heart disease, that's the number one killer, that's going to go down. Aneurysms, that's a deathly killer that basically you have about 5 minutes to get treated and you're dead if you have it in the lungs. So all these things, if you do these things, you're not going to have to worry about these crazy, chronic kidney disease, aneurysms, artery disease, carotid artery disease, coronary artery disease. And guess what? The other thing is dementia and Alzheimer's disease. What happens is in dementia patients, their brain doesn't get enough oxygen. So that's why they stop remembering things. They start forgetting things, right? And sometimes they have many strokes in their brain, which is when the blood stops and the oxygen doesn't get to the brain, and then that part of the brain dies. So you'll see in Alzheimer's and dementia patients, they can still remember things and they're still really good at certain things, but part of their brain doesn't work. And this is all preventable with getting that plaque out of your arteries, right? And that's really easy. All you gotta do is exercise, stay in shape, eat healthy, and that's gonna definitely help you. So this is one of the most important things that you can do for your health, is preventing that atherosclerosis. Hard to pronounce, but that's plaque in your veins, and that could be by your heart, um, and that could be anywhere. And another thing is when your veins, so this is like a normal vein size, right? Say for example, what happens is it fills up with plaque and it gets smaller, 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 and then all of a sudden you have a heart attack, you're dead, right? So you got to keep those veins clean. You got to keep them clean, and that's going to prevent a lot of problems. A lot of problems. Like, this is the number one problem in America, because heart disease is the number one killer, and this leads to dementia, Alzheimer's, a bunch of other things as well. So this is why you got to keep your perfusion, which is blood movement, good. You know, and your oxygen. Your body needs oxygen. Your cells need oxygen. Your brain needs oxygen. If you have that plaque build up, you're going to feel really fatigued. You're just not going to feel yourself, right? So, yeah, this is interesting. And it just, if you're 30 years old, you probably won't have to worry about any of this stuff because you're young. Or if you're 20 years old, you probably won't have to worry about it. But if you can start while you're young, exercising, eating healthy, your risks for all this is going to go way down. And your hospital bills, you're not going to have crazy insane hospital bills. So that's the other thing, is if you don't want to buy healthy food, guess what, you're gonna have to pay more money at the end. So you got to go buy healthy food. I know it might be a little bit more expensive, but I can show you there's tons of healthy food that's pretty cheap. And if you can buy that healthy food, this can help you. This will help you benefit your life. And if you can exercise every day, this will also benefit you. And it's going to decrease your chances of getting that plaque buildup in those veins, those arteries, in your brain, causing dementia and Alzheimer's. All that stuff's going to go down. So anyways, I thought this was really interesting. Hope you enjoyed. Thanks for watching. Subscribe.